For those eligible for an assessment for PSW services from Home and Community Care Support Services, the care coordinator will be in touch to schedule a home visit, or in some cases, a telephone appointment, to complete a more thorough care assessment, known as a RIDE. Depending on caseload and urgency, this could be several weeks later. The care coordinator will speak with you, the caregiver, and the care recipient to determine both your needs and discuss what HCCSS can provide. You can also request a PSW that speaks your preferred language, and they will try to accommodate if possible. If you are able to provide clear and specific requests like these are the tasks and duties I would like the PSW to assist with, and these are the days and times that would work best for our schedule, you can ask the care coordinator if they can accommodate these requests. If the care coordinator offers one 1-hour PSW visit weekly, but you know that your care recipient is used to having showers every other day, you can explain this to the care coordinator and ask if 3 1-hour visits are possible. You can mention if the care recipient had a recent fall or has an unsteady gait or medication that may contribute to the risk of falls, which may help to advocate for your situation. For context, most people who qualify for HCCSS PSW hours and are considered low to medium acuity will get 1 to 6 PSW hours a week, with each visit being a minimum of 1 hour and typically a maximum of 2, depending on the duties assigned to the PSW. This would be for a shower 1 to 3 times a week and any other acceptable duties agreed upon by you and the care coordinator. Someone with medium to high needs might receive 7 to 14 hours a week with 1 or 2 daily visits. Usually at this acuity level, the care recipient is incontinent and requires help with all of their activities of daily living, or ADLs. Sometimes people qualify for 15 to 28 hours a week. They usually are people who live alone, do not have a caregiver to help them, are likely bedbound, and require help with everything from repositioning in bed to toileting, dressing, and meals. In this kind of situation, the care recipient would probably be waiting for a long-term care bed and have a crisis designation on the waitlist. Once the care recipient qualifies for HCCSS PSW hours covered under OHIP, the hours are contracted out to a service provider organization. The service provider organization will likely schedule a home visit to conduct their own assessment with you and your care recipient. The organization will then have a scheduling coordinator arrange the PSW hours with you. They will let you know if there are any changes to the PSW schedule. If you feel your care recipient needs an increase in the number of hours provided, you would need to contact the HCCSS care coordinator. If you have questions about the schedule or the individual PSW visits, you would contact the scheduling coordinator at the service provider organization. Please note, currently, and for the past decade, there has been a shortage of PSWs across the province. This has resulted in organizations not always having available PSWs when you need them. If your PSW calls in sick or takes vacation, the organization may not have someone readily available to fill those hours. In addition to PSWs, HCCSS care coordinators can also arrange and provide time-limited physiotherapy, nurse home visits, primarily wound care, speech-language therapist assessments, some nutritional counseling, occupational therapist assessments for home safety, fall risks, and applications for assistive devices funding through ADP Ontario. We will explore how to access these services in our community supports video. To help navigate these and similar caregiver resources, visit the East Toronto Health Partners Service Directory. The link can be found in the description box below this video. For more information on navigating the healthcare system for your care recipient, watch our other navigation guide videos.